When you're a giant agency, you have a much different, very different problems than the guy who has 30 patients. If you have 2,000 patients, you need the whole regulatory structure and more. Hi everyone, this is Mariam Treystman from the Home Health Consultant, and today we're going to talk about why we started the Administrative Compliance Program. But first, if you like our content, please like, share, and subscribe. So why did we start this Administrative Compliance Program? After being in the industry for a few decades plus, one of the things that I noticed was it's hard to get information if you are looking for it that's not extremely high level or just a regurgitation of regulatory text. Not everybody is willing or able to read regulation and law and interpret exactly according to the interpretation that Medicare, CMS has, or state regulators or whatever. Over the years, we've noticed that the information out there, including webinars, in-services, conference-related information, is really geared towards big nuanced conversations, very high-level clinicals or high-level financials, but there's not a lot of information for the people who are just starting out in the industry. I think one of the reasons is that people are hesitant to interpret regulations for others. I don't know. I'm not really sure why this is, but it's been a recurring theme. And I've seen countless newbies to the industry struggle through kind of learning from friends and he said, she said, kind of my friend told me this is how it works, or this consultant told me this is how it works. And that's fine. But in the age of such easy accessibility towards information, we really felt like we wanted to make a program for and around the basics. Of course, our program covers more detailed or more nuanced problems as well. But sometimes people just need to learn the ABCs of things. Anytime I've tried to talk to bigger organizations about this or present information, for example, maybe 10 or 15 years ago, I submitted a speaker's class thing, and I submitted my proposal of home health basics, an intro to home health. And they rejected it. No problem. I'm not trying to knock it, good for them, whatever. But they rejected it, and they were saying that the reason they rejected it is because, the conference is geared towards management and owners of home health and hospice. And that at that level, people should know what they're doing on these basics. Yeah, sure. I agree. They should. Or sometimes they're new, or sometimes they have staff that's new. And you can have a very well-seasoned, for example, clinician transfer over from hospital-based work to home health, or, whatever. No one's born knowing home health and hospice regulations. And so we really felt like there was a need in the industry to create knowledge services on a more basic, digestible, and actionable level. It's been said before by many people that the hardest thing to do is to present a complex idea in a simple way. That's our goal. This stuff isn't easy. Even if somebody who's been doing it for a long time feels that it's easy, it's not. It's not easy ever to somebody new to the industry. So if you're new, you need a place to learn. And oftentimes we've seen that people who are trying to present information for this industry will just like regurgitate regulatory text. And that's fine. There's an audience for that. But a lot of times, if you're not super well versed about situations, the industry, like all the details, it's hard to read something and just like fully comprehend how it's going to work. That's why there's LCDs, right? Like even just eligibility criteria for home health, for example, homebound status. There's a lot written about it, but people still fail ADRs like constantly, all the time for eligibility criteria, which should be like day one stuff. And so it's our goal to help educate people in the industry about these, like what feels to somebody who's been in the industry like intro level topics. I don't think they're intro level topics personally. I think that you can have very high level professionals who are super niched in their roles that might not have a comprehensive idea about the other parts of the system, or just new to the industry. And so that's why we're doing this whole compliance program and like all of the articles, pods, and stuff like that. Another reason is over the years, and this is my personal opinion, I feel that the regulatory structure, while it's well-intentioned and truly probably, the best it could be, I don't like to criticize stuff without having like a suggestion, and I don't have a suggestion. So this is not a criticism, it's just like part of the why. The compliance program is created the way it is, where we're like prompting action and reminding and holding accountable to action, because the regulatory structure is created in a way where it's like, I think sometimes it's too much for a smaller company and not enough for a bigger company. When rules are like introduced through CMS or whatever, typically they'll have a comment period where people can comment on the proposed rules, and they'll have committees that come up with rules, let's say, that comprise of like agency representatives and lobby organization representatives and like whatever doctors and this and that, right? Like they'll have like the various representatives from the various stakeholders in the committee. The problem is that the representatives of the home health agency or the hospice agency will usually be massive home health or hospice agencies that are not as in tune with the challenges of smaller companies. When you're a giant agency, you have a much different, like very different problems than the guy who has 30 patients. If you have 2,000 patients, you need the whole regulatory structure and more. It's probably not enough oversight for the level of care and the amount of care you're providing in terms of committee meetings and things like that. When you have like 30 patients, oftentimes the owner is the administrator, is the office manager, is the intake. I mean, like people wear a lot of hats. And so some of these like committee requirements and like, governing body meetings, like this is all well-intentioned, good, and fully understandable why it's in place. But like when the agency is owned by like one person and that's the whole governing body, and then they have to have meetings with themselves to hire themselves as the administrator, that's silly. But it's the rule, and we understand why it's the rule, because having a tiered regulatory structure is also like impractical, and that's weird. So we're not trying to criticize the regulatory structure in this concept, but that's why we have this service. Because the guy that is like the owner and the administrator, or whatever, like the smaller company where it might be like 3 people in the office having like, they all sit in one room and talk about every case and have every case memorized. Like, they might not need like an ethics committee and a QAPI committee and a this committee and that. They're discussing every nuance at every moment in the time that it happens. Meanwhile, giant companies with like 2,000 patients, they might need more than a quarterly QAPI meeting. So that's why we have the compliance program that we've created to help agencies really like manage all of these administrative requirements that are often overkill a little for their size, in that like it's like one guy having a governing body meeting. Like, he knows or she knows that they hired the administrator they hired. I get it. If you have 2,000 patients and your governing body is like 10 people, and then like that's your board, you have a board, and then there's like the nursing department, the therapy department. Yeah, okay, sure. Yeah, you need to like get everyone in the room so that they know the updates and whatever. Like, and quarterly is probably not enough for that. But when it's like one guy with their 2 assistants in the room, and like, they are just trying to like keep the healthcare going in a positive way, and they're honestly oftentimes provide like better care than like the 2,000 person agency, just because it's like, you can wake them up in the middle of the night and they can like tell you every patient they have with their phone numbers. And like, if you ever saw Erin Brockovich, the movie, where she like could like, you'd say the name, she would like say their whole life story and their phone number. That's like the average small agency owner. And for that person who's like so involved in the care and the details, these administrative requirements feel like burden, feel like overkill, feel like we're just like filling out forms here, But they're useful because you need to have a time when you do go over like, hey, let's look at a higher level. Sometimes you're like in the weeds so much that taking a moment to look at a higher level, kind of like working on your business, not in your business kind of moment, is important. So our goal is to help the smaller to medium companies stay compliant to the rules. I mean, that's just a baseline, right? Improve their services from that higher level thing, avoid reimbursement reductions, but also to give them a place to ask a question. Because a lot of times the smaller companies don't have someone to ask. So that's the goal. And that's why we're doing this. And our goal is to give actionable, digestible content that you can read, understand what's required from you, and then do something about it. Not just like, oh, in theory, I understand what this rule is, but like now I don't know how to implement. No, like so that you have steps 1, 2, and 3. So that's pretty much the goal of the compliance program and why we started it. And again, my name is Mariam Treystman from the Home Health Consultant. Thank you so much for listening. And if you like our content, please like, share, and subscribe.